Welcome to Global India, a podcast dedicated to the well being of our listeners across the globe. I'm your host, Dr. Lily Sanathanan. Our focus today is on metabolic health, and we have with us an acknowledged expert on this topic. Dr. Robert Lufkin is a physician, professor at UCLA and USC, and a New York Times best-selling author of Lies I Taught in Medical School. Dr. Lufkin studied computer science at Brown University and completed his medical degree at the Virginia School of Medicine. He is currently adjunct clinical professor of radiology at USC, that is University of Southern California, with a focus on the science of longevity. He is also chief of medical imaging at a large medical network in Southern California. Dr. Lufkin, many of our listeners are deeply invested in their health and longevity. In your book, Lies I Taught in Medical School, you mention that many diseases, such as diabetes, cardiovascular disease, liver disease, kidney disease, cancer, Alzheimer's disease, and even mental illness are all linked to a common underlying root cause, namely metabolic syndrome or illness. Can you elaborate on this link by first defining metabolic syndrome and then tying it to the diseases I just listed? Thank you.
Hey, Lily, thanks for the invitation for this. Metabolic syndrome was first described by Gerald Raven, a scientist based at Stanford University, who described a number of conditions, including high blood pressure, glucose abnormalities, raised triglycerides, low HDLs, as well as waistline thickening. And this he called Syndrome X and eventually metabolic syndrome. And eventually, this is linked to a number of conditions. Gerald Raven basically said that it was synonymous with insulin resistance, which is now we know is also linked to inflammation and oxidation. And I believe metabolic disease is common. In fact, studies in the US have shown that over 80% of people have at least one of these metabolic markers for metabolic disease. And in my book, I talk about how metabolic disease is at a root cause, a primary root cause for all the diseases you mentioned, all the way from obesity, diabetes, hypertension, heart disease, cancer, Alzheimer's disease, even mental illness. And we go through some of the mechanisms on that. It's metabolic disease at a fundamental level is an abnormality of mitochondrial processing or mitochondrial metabolism. And I think we're going to talk a little bit more about it today.
Thank you, Dr. Lufkin, for that comprehensive response. In your book, you share your personal journey of reversing 4 chronic diseases through lifestyle changes, emphasizing the importance of nutrition, sleep, exercise, and stress management. Can you walk us through this journey?
Yes, in the book, I talk and I've spoken openly in social media about 4 diseases I came down with, which really started me on this process. It was a type of arthritis called gout, and then high blood pressure, which most adults in the US, at least over 50% have. And then also some blood fat abnormalities, which is also very common. And then finally prediabetes, which is an abnormality in glucose metabolism, which sadly is exploding in the number of people that had these. And basically my story was I went to my doctors and they prescribed a pill for each one of these diseases. And I realized after educating myself a little bit more that these pills, although they made me feel better, they treated the symptoms of the disease, that they actually didn't do anything about the underlying root cause, and the diseases would continue to progress, which was not good. So based on that, I began exploring even deeper, and I realized there's been a revolution in our understanding about what drives these diseases. And at its root, I believe, is metabolic dysfunction. But the problem is there's no real pill or surgery for metabolic dysfunction. But instead, we have something even more powerful, and that is the lifestyle techniques, which actually can improve our metabolic health and, in many cases, even reverse the diseases, but in most cases, delay their onset. And that's what I did. And fortunately for me, I was able to get off all medications. I mean, the doctors couldn't believe it. They thought the machines were broken, but I had a happy outcome from that. And now I've made it my mission to help educate others so that they don't make the same mistakes that I did.
Thank you, Dr. Lufkin, for that inspiring narrative. Your book refers to outdated medical paradigms that treat symptoms rather than the root cause. Instead, your book calls for a shift toward more holistic and preventive approaches. Can you tell us more about this paradigm shift and why it is important?
Sure. Let's just take one example. In the book, I go through many different diseases with a chapter on each one. But type 2 diabetes, which is essentially insulin resistance, is fundamentally a metabolic disease, and it drives many other metabolic diseases. The current recommendations for treating type 2 diabetes is to take pills or insulin, metformin and others, or eventually insulin. And the problem with this is, although the insulin will be life-saving and can save someone from dying of a hyperglycemic coma, the sad part is that the insulin doesn't really control the long-term complications of diabetes, which continue to go on, even though it's controlled, the sugar levels are controlled with insulin. These are things like surgical amputations of the extremities, renal failure, dialysis is the number one cause, heart attacks, Alzheimer's disease, cancer. These are all increased risk with Alzheimer's disease. Now, on the other hand, what I don't think is emphasized nearly enough to patients is that that's not the only choice for treating type 2 diabetes. Type 2 diabetes is fundamentally a carbohydrate toxicity. Of the three macronutrients, which your audience probably heard about, fats and proteins, which are essential, carbohydrates, the third group, which is sugars and starches and flour and rice, are not essential at all. And these are what drives type 2 diabetes by driving the insulin up. And for many patients, over half patients, if they go on a low carbohydrate diet, it's been shown with controlled studies that they can reverse their type 2 diabetes. But the interesting thing is, unlike controlling it with insulin, which is the current recommendation, when a patient reverses it with diet, they actually stop the progression of the disease, and these long-term complications are greatly reduced if they occur at all. And that's really the exciting opportunity. And this applies not just to type 2 diabetes, but it really for all those diseases that we mentioned.
Thank you, Dr. Lufkin, for exposing the flaws in conventional medical education and practices and for suggesting a new way forward. Specifically, you talk about a plan for taking control of our health, starting with nutritional choices. Can you dive into this plan and give us a few pointers?
So what's the plan for metabolic health, this lifestyle? And arguably, lifestyle, I would submit for most of us, is the most powerful medicine that any of us will ever take, more so than the pills or surgery that we're given in most cases. So what is the lifestyle? Well, it's about correcting our diet, our sleep, our exercise, and stress. And we go through it in detail in the book, but I'll just give you some basic things on the diet. For example, it's not just what you eat, but when we eat. So we want to narrow the eating window, not eat all the time, not snack between meals, even skip breakfast if you can, and try intermittent fasting. Then what do we eat? For me, it's simple. If you just eliminate junk food. Well, what is junk food? Well, it's typically foods that have carbohydrates, sugars, refined carbohydrates, starches, flour, rice. All these things spike our insulin and drive insulin resistance and drive metabolic disease. So we minimize carbohydrates in our diet. What do? We replace those with fat. Protein stays pretty much the same, but we lower the carbohydrates, we increase the fat. And when we increase the fat, it's important. It's not just any fats. It's healthy fats, which tend to be saturated fats or things like avocado oil or olive oil, because there's a whole class of very harmful fats that have been developed in the 20th century. They're called seed oils or industrial seed oils, things like canola oil and rapeseed oil and corn oil. Problem is they're very inexpensive and they're used in salad dressings and junk food all over. And the problem is these drive oxidation and drive metabolic disease. So when we increase our fats, we have to avoid seed oils and just eat healthy fats. And then the last stage is grains. I avoid grains. I'm not gluten sensitive. I don't have celiac disease, but because of the proteins in the grains that trigger low-grade inflammation in many adults, I think it's worthwhile to leave those. And finally, grains tend to have high carbohydrates, so that's another reason to leave them. And then in the United States, I'm not sure the status in India, but in the United States, all our grains are literally soaked in a poisonous weed killer called glyphosate, which is outlawed in around 30 countries around the world because of its association with cancer. But in the United States, sadly, our grains are still soaked in it. So those are basic ideas of the plan, and we go into more detail on my website or in my book or there.
Thank you, Dr. Lufkin, for your helpful tips. You also talk about the need to spot warning signs early before it's too late in order to reverse the trajectory of an illness. Given your emphasis on metabolic health markers for early detection of chronic diseases, I would like to mention HealthWiz, a web app that provides a diagnostic health score and the risk of metabolic syndrome based on body mass index, systolic blood pressure, fasting glucose, triglycerides, and HDL cholesterol. For the benefit of our listeners, I might add that this web app can be accessed by typing in healthwizapp.com. That is healthwizapp.com. What is your take on this tool for monitoring and improving overall health?
Apps like HealthWiz or anything that get us to pay attention to the biological markers are so important, because one thing that I didn't realize before in writing this book was that if we wait until if we wait until the doctor diagnoses our Alzheimer's disease or type 2 diabetes or high blood pressure, we've missed an opportunity. What is that opportunity? Well, we now know that these diseases don't start when the doctor diagnoses them. They actually start years to decades before that. And if we wait until the doctor says, well, you've got type 2 diabetes, or, oh, you've got Alzheimer's, you can't find your keys, we've missed a tremendous opportunity for prevention through these lifestyle changes, again, that improve our metabolic health. And that's the opportunity. Apps like HealthWiz and others that get us to look at these markers and pay more attention to them before we're diagnosed with the disease are tremendously helpful.
Thank you, Dr. Lufkin, for an enlightening session. I enjoyed reading your insightful book, Lies I Taught in Medical School, where you explain basic facts in simple terms. I would urge all our listeners to read this book and follow the plan that you have so meticulously laid out.
One thing, if you'd like to do, is if people are interested in my book and they want to download a free chapter, they can go to robertlufkinmd.com and just click on Lies, and they can download a free first chapter of my book in both PDF and MP3 form. See if you like it. That's it. Thanks so much.
Thank you again, and thanks to all our listeners as well.